Hi everyone, how are you doing? Today we are going to cure your fear of going to the dentist. You see, fear is a normal thing, okay? We're all fearful of something. And recently I read a book and it suggested that even babies, we're born with a fear of snakes and a fear of heights. But a fear of the dentist, that's kind of man-made. And in this video, I'm going to give you a whole bunch of tools and techniques that are going to help you cure your fear of the dentist. Now, it's not quite as simple as that because you do need to find a practice who are going to accommodate and who understand the psychology of fear. Now, the good news is a lot of places do this these days. And I'll share with you the techniques that we use, and hopefully you can find someone local to you that you can kind of overcome this fear and help yourself get the treatment that you feel you need. Now, over the years, we've helped so many people, and a lot of our patients have had this really bad anxiety and fear of going to go and see the dentist. And this ranges from patients who were crying as they came in to even have a consultation or a conversation with us, to I've had to take teeth out with a patient sitting in the chair, but not the dental chair because that's what triggered him. He was sitting in the kind of the other chair in the room, if you will. But the good news is, for the vast majority of cases, I mean, there's only one or two that I can think of, we have been able to help them, and we have been able to do the kind of complex stuff which we do kind of routinely. And the kind of stuff I'm talking about is complicated surgical stuff. So we've been able to take extremely anxious patients and build them up in a way that they are able to have this treatment, and most of the time it's without drugs. Okay, I will talk about the drugs and sedation and all that stuff that you can have done, okay, but there's two elements to this. There is what the practice can do to help you, and also there is what you can do to help yourself. And the vast majority of this video is all about the stuff that you can do to help yourself. But before we get into that, let me just quickly summarize in a sentence or two what we do. And in essence, we can put it down to just giving our patient the control back, because 99% of the time, this fear that we feel comes from a really bad childhood or young adult experience, and these bad experiences stay with us. Then we decide that, you know what, every time I go to the dentist, this is what the outcome is going to be. I'm going to have that same pain again. The dentist isn't going to listen to me when I'm telling it's hurting. They've got, you know, it's a really difficult extraction. The dentist is sweating, swearing, knees on chests, all this kind of stuff, okay? And we play back this story in our mind about how it's going to be. Now, the truth is, it's not always going to be like that. You did have a bad experience, but let's put that on the shelf somewhere. Let's crunch up that memory and just throw it in the bin, because now we're starting fresh. Times have moved on, and in the busy days of being in an NHS clinic where the dentist really doesn't have much time to help you, it's all a bit of a rush. And when things are rushed, as a patient, you feel like you haven't got control, especially if the dentist is taking a tooth out and it's really hurting and they're not stopping and they're telling you that it's not hurting. So let's break the cycle and let's get over this together. The first thing that I think is really useful is to be honest with yourself and figure out what is it specifically that triggers you. Try not to say that, oh, it's the whole experience, because the experience is made up of so many things. For some patients, it's sitting in the chair, like the guy I spoke about. For some people, it's the injections. For some people, it's the smells or the sounds of the drills, okay? All of these things contribute to this experience, but quite often, one of these things is more offensive to us than all the others, okay? So try and be honest with yourself and figure out, what is it? What's the worst thing about going to the dentist? This exercise will help you kind of think about the whole experience in a little bit more detail and be more logical about it rather than coming at it from an emotional point of view, okay? Because if you've had a bad experience, we're going to be very emotional about that whole experience. Now, the next thing you're going to need to do is find a dentist, or a dental clinic, I should say, who is not going to rush you. because all these anxieties typically came from being rushed. Now, in the UK, I'm going to put myself out on a limb and say that NHS practices don't have the time needed to help somebody who has a lot of dental anxiety. And this is all down to the whole mechanics of the system. They just don't have enough time to spend with each patient. And in my experience, people who have had bad experiences and are anxious, we just need to take things slow. Okay, so you need to find a dental practice who will be able to help you. And it's not just the dentist, it's really the whole team. It's Deborah on front desk, it's Tanya, the treatment coordinator, and the dentist. Everybody needs to be kind of open and chilled out to kind of get you over all of this. A good way to maybe test out practices is just make an inquiry. These days, most of our inquiries come from our website, and there's usually a little text form that you can fill in. You don't need to say much. Maybe something as little as, hey, look, I'm super anxious. Is there somebody who I can speak to about dental treatment? Okay, literally that's it. Because the first stage of making contact is just having a conversation. And I know that for some people, even this is a massive hurdle. Okay, so you don't need to give your whole life story on this email inquiry. You know, there will be a time for that. We want to understand all of this. However, let's make the first step and let's almost test the practice out. If they come back to you and all they want to do is book a consultation where you got to pay money, you know, maybe they're rushing a little bit. We're in the job of helping patients, and every patient is slightly different. So if you just want to speak to someone, that's absolutely fine. Most practices these days will have treatment coordinators, and their job is really to listen and understand and to see if you're a good fit with the practice. I recently went on a seminar about all of this stuff, and one thing that they mentioned is some patients would find it really useful to write a letter. This letter is basically to the dentist or to the practice, explaining why you feel the way that you do and what your triggers are, what got you to this stage, what you're looking to achieve, stuff that the practice can do to help make your experience better, and also, really importantly, what stuff can you do to make your experience better. Putting everything on a piece of paper will really help. Now, some of our patients will put a lot of this information on the website inquiry, and that's absolutely fine. However, this isn't something that we really do that much, just because for every new patient that we see, we typically book 2 hours just for the consultation. So we've typically got a lot of time to go through this all in person. But if you're really anxious, you haven't even set foot in the dental practice, and that triggers you, maybe writing a letter is a really good first step. And this allows you to take things nice and slow, take things at your pace. If on stage one, all you want to do is speak to someone, that's absolutely fine, just have the conversation. Then maybe on another day you want to come in and just sit in the car park. That's absolutely fine. Maybe the third day you want to come and step inside into the reception, maybe have a coffee, something like that. Everyone's different. Everybody has a different level of anxiety. What I've described is pretty rare. Typically after a conversation with the treatment coordinator, so you can kind of interview us and see if we're a good practice for you. The next stage would be come in and have a conversation with the clinician. But it doesn't always need to be in that order. See what you feel comfortable with and just take it, you know, step at a time. If you get to the stage of booking a consultation, I think it's worth asking how long that consultation is and if you can have extra time if needed. The reason is, I know we book far longer for our consultations than 90% of private practices. I mentor a bunch of dentists, and when they hear that we book about 2 hours, their response is, yeah, there's no way that they can book 2 hours. Now, 45 minutes of that 2 hours is literally just understanding the patient's situation. So I'll typically go into the room and I'll say, hey, Mrs. Jones, how you doing? How can I help you? And then Mrs. Jones will just start talking, and that's where anxious patients are able to kind of just unload all their histories. It helps me in a lot of ways trying to build that perfect treatment plan for that patient. But it also helps the patient just talk about it, just verbalize all these things, because often we hide them all inside. And a problem shared is a problem halved. Okay, you could do this with the treatment coordinator or the reception team, whatever. It's important at every stage. For me as a clinician, it's important for me to build the right treatment plan, but for you as a patient, it's just important to talk about these things. The next little tip is almost a cheat code. This is all about breathing. Breathing and meditation, right? It's just such a useful technique to control your mind, especially when anxiety is creeping up and it's all getting a little bit too much. So really what you want to do is be very aware of your breathing. This is step one, and you can practice this in bed at night. Just try and think about nothing other than your breath in and out, okay? And try and just slow it down. There is a technique, it's called box breathing, which I've read about, and this can probably help a lot of people as well. And it's basically, you just imagine a box, okay, it's a square box, and you breathe in for 2 seconds, you hold for 2 seconds, you slowly exhale for 2 seconds, and you hold for 2 seconds. And just by drawing this box in your mind, it helps distract you from whatever it is that's causing anxiety, and you're focusing on your breath. You're trying to really control your breathing, and this will lower your heart rate and it will lower your level of anxiety. I understand this is easier said than done, but if this is completely new to you, I would definitely practice this at home. Practice it when you're driving. Just try and really be in control of your emotions. And this isn't a case of like suppressing your emotions. It's just that when we play back that movie in our head about all the anxieties, our heart rate starts rising. To give you an example of something kind of like this, occasionally I'll do an open mic night at my, there's a pub near me. And this involves me getting up on stage by myself, playing guitar and singing. Okay, I've only started singing a year ago. It's really outside my comfort zone, and I really don't like being in front of people. And sometimes I'll wear like a Garmin watch which registers my heart rate. And even when I set foot into this pub and I'm watching somebody else perform, my watch will give me heart rate warnings. And this is because I'm playing back a movie in my head about me going on stage, forgetting the words, forgetting the lyrics, singing out of tune, all of this kind of stuff. I'm basically telling myself that this is a complete disaster and I'm pretty much going to die at the end of it, okay? The truth is, you go up there, it's really not as bad as what I had in my head, and you know, people clapped at the end of it. So we always tell ourselves these horror stories and we believe it, okay? We just need to be able to control our nerves, and controlling our breathing is a really good way to do this. Now, let's say you've got over the consultation and now the dentist has provided a treatment plan for you and it's got all this complicated stuff in there, okay? This might put you on edge because up till now, it's just been talking. The actual treatment is going to start soon. Maybe there's elements of that triggers you. My best advice here is start with something small. Maybe a hygiene session with the hygienist. A lot of hygienists can use local anesthetics to numb things up, because I know that if your gums are unhealthy, then quite often even a hygiene session can be pretty uncomfortable. You might not necessarily need the injections for numbing. Just what we call topical spraying on the gum will do a little bit of numbing, and that might be enough to make it kind of comfortable enough for you. But I would start with small things, just fillings and hygiene sessions. These things, you're kind of in and out within 30 minutes. You get to meet different members of the team, and it's basically a taster of how things are going to go. And what we find is once our patients have had a little treatment, then doing something a little bit more complex isn't that much of a stretch. By even saying all of this, There will be times in the whole treatment process where you're not feeling it, and that anxiety starts to creep up a little bit. In those situations, I would really try and focus on the goal. What are you trying to achieve here? What is the end goal? Do you want to be able to smile confidently? Do you want to be able to eat the kind of food that you love eating without thinking about what you can eat, what you can't eat on a menu? Remind yourself of all of these things. That's the reason that you started this whole journey in the first place. See, there's two reasons. You're either going towards a goal in your head, or you're moving away from pain and discomfort. If you're moving towards a goal, that's usually your own choice, that you want to do this, you want to achieve that goal. If things have got so bad that things are so painful, you're trying to move away from this bad stimulus. That's where things like get a little bit more desperate, okay? Because typically you're in pain and you need to solve that pain. Definitely solve that pain, but continue down the path and have this goal of what you want to achieve in the foreground. Now, how can drugs help you achieve this? Doing all of this stuff, and even though I'm no pain and anxiety expert, I think we're pretty good at helping a lot of our patients cross this barrier. A lot of the patients that I spoke about, people who were crying before they came in, quite often at the end of treatment, they'll just walk in just like anybody else and open their mouths to have checkups and hygiene sessions. And it's really nice to see that. Like, it's a mental shift that causes this transition. We're basically proving to the patient that every dental experience isn't like that really bad one that you had. But even with all of these techniques, for some patients, having treatment is just a little bit too much. So that is where things like sedation come in. So in our clinic, we have an external company, and it's all hospital sedationists who come in and they will give drugs in the arm typically. Okay, so there is the laughing gas, which is great for shorter appointments like hygiene sessions. We don't actually do this, but I know a lot of practices do have this. And the kind of the in-arm sedation is usually better for the big treatments, so implants, anything surgical, veneers even, we've done it. And the nice thing about it is that it gives you this period of amnesia, so you don't even remember having the treatment done. You're not put to sleep, you're in this kind of deep relaxed state, and once the treatment is done, we'll bring you out of that state and you'll remember everything at that time. But 24 hours later, there are massive black areas in your recollection. And a lot of patients like that. The downside with things like this is that you do have to be pretty medically fit and well, and you need to bring somebody with you. You can't drive after this treatment, and for 24 hours somebody needs to be with you afterwards as well. You definitely shouldn't be signing important documents, you shouldn't be going on eBay, you shouldn't be doing any online banking, any of this kind of stuff, just because you're going to forget about it. Yeah, the classic one we tell patients is don't make your own food, because you could just stick your oven on and completely forget about it. So there's a level of inconvenience there. I prefer to do treatment on patients who are not sedated, just because they are typically more cooperative. When somebody's sedated, we have to constantly remind them to breathe and to open their mouth. Okay, so that's a little tiny irritation on our side, but really we need to figure out a plan that works for you. And if sedation is the right thing for you, then excellent, let's use it. But the goal isn't to kind of just patch up the anxiety with drugs. Yes, we can use the drugs to help you achieve the end goal of really making you comfortable going to the dentist. That's the end goal. I want you to be one of those patients who is terrified to begin with, but we've helped them on this journey and we've given them enough confidence and trust so that they're able to come in for checkups and hygiene sessions just like they never had any anxiety at all. If you made it this far into the video, thank you. Give the video a like, give it a thumbs up, and tell me about your experiences. I'd love to hear about your unique experience. You can pop that in the comments, and I read a lot of them, especially if the video is new. I will be reading every single one. Until next time, guys, I hope this really helped you, and I hope that you can get on with your life without your dental situation holding you back. I'll see you soon. Take care.